Hi, and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today we're going to be talking about yeast treatment. Yeast can be really tricky to treat, and so I wanted to give you a little bit of an overview so you're a little more familiar than you were before about what are the options for yeast treatment. If you haven't already, please check out the previous 2 videos in this yeast series. The first one is on signs and symptoms of yeast, and the second one is on testing. How can you test to tell if your child might have yeast? It's really important to treat a yeast overgrowth in our children, especially when they have autism. Many times the yeast overgrowth can be one of the root causes of these bothersome symptoms that our kids experience. So when we treat the yeast, we can often see an improvement in these bothersome symptoms. Okay, let's jump right in. So the first medication I'm going to tell you about is called Nystatin. No relationship to lovastatin, simvastatin, the cholesterol lowering drugs. Nystatin is an antifungal medication. It's a prescription. It's available at mostly all pharmacies. It's very common, usually covered by insurance, and even if it's not covered by insurance, usually relatively inexpensive. So those are a few of the pros already. A few other advantages of Nystatin is that it's usually very well tolerated and has few side effects and few drug interactions because it acts locally. So whereas other medications are absorbed systemically into the body, they get into the bloodstream, and the medication then is spread throughout the body, Nystatin really only works locally. So, which is both a disadvantage and an advantage. So you really need to know what you're treating here. Now, if you're treating intestinal yeast or oral thrush yeast, then the Nystatin is a great choice. And that's usually what we're dealing with, is intestinal yeast with our kids. So the Nystatin can be a really great choice. Another commonly used prescription medication for yeast or candida overgrowth is called Fluconazole, or brand name often is called Diflucan. You may be familiar with this because it's often used for vaginal yeast infections as a 1-pill treatment. For children with yeast overgrowth, oftentimes the treatment protocol is a lower dose for a longer number of days. So Diflucan has a few advantages. Some of them are similar to the Nystatin. One of the advantages is that it's readily available at most pharmacies, covered by insurance, and even if it's not, again, it's relatively inexpensive. The other advantage of Diflucan is that it readily penetrates into tissues, and so if there are concerns about skin infection with candida, or more widespread or worse infection, worse overgrowth with the candida, the Diflucan is kind of a more strong medication to choose and can treat a worse or more widespread infection a little better than Nystatin. While Diflucan is a very effective choice for treating a yeast overgrowth, there are a couple things to know. It can be hard on the liver, and so it's wise to monitor liver function labs while your child is on the Diflucan, depending on how long they're on it for. And the other thing is that because the Diflucan is filtered by the liver, it can affect how other medications are filtered by the liver as well. And so there's a higher potential for drug interactions with the Diflucan, especially as compared with the Nystatin, which has very few, if any, drug interactions. If the yeast overgrowth seems to be a mild to moderate problem, and depending on the patient's preference, I'll very often use some combination of these next natural treatments. However, if the yeast overgrowth is more severe or more widespread, it really usually is necessary to use a prescription medication, maybe even in combination with one of the more natural methods, but we really want to knock that yeast out. And so using a prescription medication for the more severe overgrowth issues is wise. One of the more natural ways to address mild to moderate yeast overgrowth is by giving good yeast to kind of crowd out the bad yeast. One of the most common ones we use is called Saccharomyces boulardii, or S. boulardii for short. This is a probiotic, a yeast probiotic that comes in capsules usually and can be emptied into things like food or applesauce so they can be easily taken. And especially for the mild to moderate infections, this can be really effective. Now that probiotics have been around for a little while, more studies are available on what they do and what they don't do. And what we're finding now is that certain strains of probiotics are responsible for certain benefits. And so there can be cases where certain strains of probiotics can be used to help balance out or kind of crowd out yeast overgrowth in the intestines. The probiotic approach is a rebalancing approach, which can be effective for mild, maybe moderate cases of yeast overgrowth, but sometimes you need an additional layer of treatment aimed at killing the yeast overgrowth so that it's easier to rebalance. Many of the products on the market aimed at killing the yeast are combination products, and this is because yeast can be very tricky to treat. It can morph and change, and so while one thing may have worked initially, that same formula doesn't work anymore. So we kind of have to evolve our treatment with the evolution of the yeast. And typically what that looks like is treating with one thing for a couple of weeks, then changing it and kind of rotating treatments every few weeks. So we're still making sure that what we're taking is killing the yeast. A few of the more effective herbs are caprylic acid, podiarco, and black walnut. You'll very often see those ingredients in different yeast killing formulations. Many times in the yeast treatment formulations, you'll also find various enzymes because yeast can be hiding in what's called biofilms, or sort of like a sticky mucus. The yeast can hide in these biofilms to protect itself from being killed. And then when we take certain herbs, those herbs don't always penetrate into that biofilm. And so by giving enzymes with the herbal yeast killers, we can allow those herbs to penetrate into the biofilm because we've broken that biofilm down with enzymes. There are two essential oils that can be used really well to treat yeast infection as well. Oil of oregano and thyme essential oil can be used. Be very careful because oil of oregano is different than oregano essential oil. Oregano essential oil you have to be really careful with. It's a very, very strong essential oil. Oil of oregano is a more diluted form, and so that one is much safer to take even orally with supervision. I do want to just give a little warning about taking these natural products. You do want to make sure that either you have read up on it and feel confident that you are using them safely, or consult with somebody who knows how to use them safely in different age groups. Just because something is natural does not mean it's going to be safe no matter how you use it. And so using these natural products wisely is really important to ensure that your child stays safe while you're trying to treat a yeast overgrowth or anything else. Well, thank you for joining me for this video on ideas for yeast treatment. I hope this has been helpful to you and given you the knowledge and empowerment to know that you are doing a good job creating your child's autism game plan. As always, if you'd like to email me with ideas for future video topics, I'd love to hear from you. My email address is joya@yourautismgameplan.com. And remember, be gentle with yourself. You're doing a great job.